Welcome to the Deep Dive. We take complex topics, sort of break them down, and help you get straight to what really matters. Today, we're jumping into equine reproduction, specifically a condition called prolonged diestrus in mares. Now, you might be thinking, what's that? But trust me, it's a really critical puzzle for anyone involved with horses. Breeders, owners, even just curious animal lovers. Our mission today is to demystify this common, but often quite frustrating reproductive issue. We'll explore what it is, why it happens, and how it's managed. Think of it as a look behind the curtain at the intricate biology of horses and, well, the clever ways experts help keep things running smoothly.
It really is fascinating. We're talking about what seems like a simple reproductive hiccup, but it actually has this whole cascade of complex biological reasons behind it. Understanding these nuances, it isn't just about veterinary science. It's about appreciating the delicate balance required for life itself.
Okay, so let's unpack this. Before we get into what goes wrong, maybe we should establish the baseline.
Yeah.
What does a normal estrous cycle actually look like for a mare? You kind of need to know normal to understand the deviation, right?
Absolutely. That's the foundation. So a mare's normal cycle averages around, say, 21 to 22 days. It can range, though, maybe 19 to 26 days sometimes. It basically has two main phases. There's estrus, which people call heat. That lasts about 5 to 7 days. During estrus, the mare is receptive to the stallion, a dominant follicle develops, and it ends with ovulation. Then comes the second phase, diestrus. This is typically longer, about 14 to 15 days. It starts right after ovulation, that spot where the follicle ruptured. It transforms into something called a corpus luteum, or CL. And the CL, its job is to produce progesterone.
Okay, progesterone. So that's the key player during diestrus. What exactly does it do?
Exactly. High levels of progesterone basically put the brakes on everything else. It stops more follicles from developing and prevents the mare from showing heat behaviors. Now, here's where it gets really interesting for our topic today. If the mare isn't pregnant by about day 14 or 15 after ovulation, the uterus itself sends out a signal. It releases prostaglandin F2 alpha, or PGF2. This PGF2 causes that CL to regress, to break down. We call that luteolysis. When the CL regresses, progesterone levels plummet, and that allows a new wave of follicles to develop, bringing the mare back into heat. It's all beautifully timed.
Right, a really elegant biological dance, as you say. So if that's the normal rhythm, what throws it off, what causes the music to stop or the dancer to just stay in that diestrus phase too long?
That's prolonged diestrus in a nutshell. It happens when that normal luteolytic mechanism, that PGF2 signal, gets disrupted, or simply when the CL persists well beyond its normal lifespan. And that obviously can significantly impact breeding efficiency and just general management.
So what are the most common reasons you see this happening? Why doesn't that PGF2 signal work sometimes?
Well, the most common reason is a failure of that PGF2 release itself. This leads to what we call a persistent corpus luteum, or PCL. Often we can't find a specific underlying cause. We call it idiopathic, but it can definitely be related to things like inflammation or maybe scarring, fibrosis of the uterine lining. That can impair the uterus's ability to make the prostaglandin. It might affect, say, 8 to 10% of cycles normally, but it can jump up to 25% during the fall transition period. And sometimes that CL can hang around for about 2 months.
2 months. That's a huge delay in a breeding season. Okay, so that's one major cause. What about cases where maybe a pregnancy started but didn't continue?
Yes. That brings us to early embryonic death, or ED, specifically after maternal recognition of pregnancy. This one is particularly frustrating. Here's the sequence. If a mare conceives, the very early embryo signals its presence around day 14 to 16. This signal blocks the PGF2 release. It tells the uterus, hold on, don't destroy the CL. But then if that embryo dies later, maybe between day 18 and 30, or even up to day 35 or 40, the CL still persists because that initial stop signal for PGF2 release was already sent. The damage is done, so to speak.
Wow, so even a pregnancy that's barely established can have these really long-lasting effects if it fails.
Exactly. And it gets even more complicated if the embryo dies after these things called endometrial cups have formed. These form around day 35 to 40. They're specialized structures in the uterine lining. The tricky part is, even if the embryo dies, these cups can continue producing a hormone called equine chorionic gonadotropin, or ECG. And ECG supports the existing CL and even stimulates secondary CLs to form. So you end up with this prolonged progesterone production, sometimes preventing the mare from cycling for, 120 to 150 days after ovulation. It's a long time.
Goodness, that's almost half a year potentially lost. So besides these CL issues and early pregnancy problems, what about issues with the uterus itself? Can physical problems cause this?
They certainly can. Things like uterine infections or endometrial degeneration. So pyometra, which is pus in the uterus, or endometritis, inflammation, or even extensive endometrial cysts and fibrosis, that scar tissue we mentioned. These conditions can physically damage or just functionally impair the uterine cells that are supposed to produce and release PGF2. If those cells aren't working right, you don't get enough PGF2, and the CL persists. This tends to be more of a chronic problem, especially, in older mares. We also sometimes see something called Diestrus ovulation.
Diestrus ovulation.
Yeah, it's when a new follicle ovulates late in the diestrus phase, forming a new CL right around the time the normal luteolysis signal should be happening. This new, maybe immature CL can be resistant to that natural PGF2 pulse.
Okay, quite a list of internal factors, but what about external things? Are there ways humans can inadvertently cause prolonged diestrus? You hear stories?
Unfortunately, yes. We call these iatrogenic causes, meaning they're induced by treatment or intervention. For instance, there are certain gonadotropin-releasing hormone agonist implants. If they aren't removed promptly after ovulation, they've been linked to prolonged cycles. Also, perhaps surprisingly, the hormone oxytocin. If it's given repeatedly, say from day 7 to day 14 after ovulation, or even for longer periods, it can prolong the CL's function. And yes, you hinted at this earlier. Historically, people used to place intrauterine glass marbles.
The marbles. I've heard of that.
Right. The idea was to mimic a pregnancy and prolong the CL, sometimes up to 90 days. But it's really not recommended anymore. There were issues with marble shattering, causing uterine reactions, and frankly, the effectiveness was highly variable. We've also seen that intrauterine infusions of certain plant oils can sometimes have a similar effect, prolonging CL function.
Fascinating how interventions can have unintended consequences. What about mares nursing foals? Does lactation play a role?
It can sometimes. Lactation can occasionally lead to a persistent CL, especially after the first ovulation following foaling. This seems more common if mares foal in winter or maybe aren't in the best body condition. It's a bit different from lactational estrous, which is just a general period of not cycling while nursing. And although it's not strictly the same mechanism, mares going into seasonal estrus, particularly during that fall transition phase, can sometimes experience these prolonged diestrus-like periods before they shut down completely or resume cycling.
Okay. Any other, maybe less common but still important causes we should know about?
Yes, one more to definitely keep in mind is a granulosa cell tumor, or GCT. It's the most common type of ovarian tumor in mares. And these tumors can actually produce hormones themselves, including progesterone sometimes, or others that disrupt the cycle. This can lead to prolonged diestrus or even complete anestrus. Usually you'll find one ovary is significantly enlarged on examination. It's a really important differential diagnosis.
Right, so quite a range of possibilities. When you have a mare that just hasn't come back into heat as expected, it really does sound like detective work. How do you actually figure out which of these is the cause?
It absolutely is detective work. The diagnosis relies on putting together clues from several sources. First, a detailed breeding history and careful cycle charting are essential. You need to know the date of the last known ovulation. That sets your timeline. But the real key, the cornerstone, is transrectal palpation and ultrasonography. With palpation, you typically feel a uterus that's toned and firm. That's the effect of progesterone. Then, with the ultrasound, you can visualize the ovaries and actually see if there's one or more CLs present. If it's a recent ovulation, it might look like a corpus hemorrhagicum, kind of a blood clot appearance in the center.
Okay, so the ultrasound is central. You mentioned progesterone influence. What about directly measuring hormones? And what's the most critical thing you're looking for on that initial ultrasound?
Yes, hormone assays are very useful. A serum progesterone test showing levels greater than 1 nanogram per milliliter definitively tells you there's functional luteal tissue present. That confirms prolonged diestrus if the mare isn't pregnant. And to your other point, the most critical thing with that initial ultrasound is ruling out pregnancy. Absolutely number one.
Why is that so crucial?
Because the standard treatment for prolonged diestrus involves prostaglandin, which causes luteolysis, breaks down the CL. If you give that to a pregnant mare, it will induce abortion.
Ah, okay. Devastating mistake to make.
Exactly. So rule out pregnancy first, always. The ultrasound also lets us check the uterus itself for fluids, cysts, signs of infection, more clues.
Got it. So ultrasound rules out pregnancy, checks the uterus, confirms the CL. Blood tests confirm the progesterone. What about those other specific causes, like the EE with endometrial cups or the tumor?
Right. So if we suspect early embryonic death occurred after those endometrial cups formed, we can run an ECG assay. If it's positive, that confirms the cups are still active, even if the embryo isn't there. And if we suspect a granulosa cell tumor based on, say, an enlarged ovary and the mare's behavior, we run specific hormone panels checking levels of inhibin, testosterone, and AMH, which are often elevated with GCTs.
So you piece it all together, the history, the palpation, the ultrasound images, the hormone levels.
Precisely. You combine all the findings, rule out pregnancy and ED first, especially if she's been near a stallion. If you suspect pyometra or endometritis, you might do a uterine culture, cytology, maybe even a biopsy. If it's a performance mare, you'd specifically ask about her treatment history, oxytocin use, maybe even those old marbles. Sometimes you can actually see a faint shadow of a marble on ultrasound or find it with hysteroscopy. And then, if after all that you still can't pinpoint a specific cause, we classify it as idiopathic or spontaneous.
Okay, the detective work is done. You have a diagnosis. What does this mean for getting that mare back on track? How do you actually treat prolonged diestrus?
The main goal is straightforward: induce luteolysis. We want to break down that persistent CL so progesterone drops and she can return to estrus. The drug we use is prostaglandin F2 alpha, PGF2A, or one of its synthetic analogs. Common trade names you'll hear are Lutalize, which is dinoprost tromethamine, or Estromate, which is cloprostanol. These drugs mimic the natural prostaglandin and cause the CL to regress pretty rapidly.
And what's the typical timeline after treatment? How quickly does she respond?
Assuming the CL is mature enough to respond, mares usually come back into estrus within about 2 to 4 days. Ovulation then typically follows within 6 to 12 days after the treatment, though that depends a bit on the stage of her follicular wave when you treat her. But again, the absolute prerequisite is confirming she is not pregnant before giving PGF2A. Can't stress that enough.
Understood. Are there side effects to the prostaglandin treatment?
Yes, there can be some transient side effects. They usually occur within 15 to 30 minutes of injection. You might see sweating, maybe some mild colic signs, increased breathing rate, sometimes loose manure or diarrhea. It's all due to the drug stimulating smooth muscles elsewhere in the body. These effects usually resolve on their own within an hour or two. Cloprostanol, estromate, generally seems to cause fewer or milder side effects compared to dinoprost.
Are there any mares who shouldn't get this treatment at all? Any contraindications?
Yes, definitely. PGF2 and its analogs are contraindicated in mares with respiratory issues like equine asthma or other bronchoconstrictive diseases, as it can worsen their breathing. And there's a really important human safety aspect too. Pregnant women or anyone with asthma or bronchial problems should be extremely careful handling these drugs, or ideally avoid it altogether. Any accidental skin contact should be washed off immediately and thoroughly.
Good advice. So prostaglandin deals with the persistent CL itself, but what about addressing those underlying causes? We talked about the uterine issues, the GCT.
Right, the prostaglandin is often just step one. For underlying problems, you need further management. If there are severe endometrial cysts or significant fibrosis, treatment might involve things like hysteroscopic laser ablation to remove large cysts or uterine lavage to clear inflammation. If the diagnosis is a granulosa cell tumor, the definitive treatment is surgical removal of the affected ovary. Usually, the remaining ovary takes over and resumes normal function eventually. For seasonal and estrous issues, using artificial lighting protocols can help stimulate earlier cycling. And for lactational issues, focusing on improving the mare's nutrition and body condition score is often the key. And really, in well-managed breeding programs, proactive monitoring is crucial. Doing routine ultrasound pregnancy checks, say around day 14-16 and again maybe day 25-30 after ovulation, lets you catch pregnancies early but also identify ED promptly. If a mare is confirmed non-pregnant or if you detect an ED, you can give PGF2 right away to short cycle her, bring her back into sheet quickly. That's vital for maximizing reproductive efficiency throughout the season.
That makes a lot of sense. So wrapping this up for our listeners, for you.
Yeah.
What are the key takeaways here? We've really journeyed through the complexities of prolonged estrus, from understanding that delicate normal cycle balance to seeing all the ways it can be disrupted. Persistent CLs, early embryonic loss, uterine health, even human actions or tumors. It really highlights how complex these biological systems are and the detective work needed to manage them.
Absolutely. And if you connect this to the bigger picture, it underscores just how finely tuned reproductive hormones are, really in all mammals. A seemingly small disruption can have pretty significant consequences for fertility. But the encouraging part is that for prolonged diastresis specifically, prompt diagnosis and using prostaglandin therapy appropriately usually gets things back on track quite quickly, and that is critical for success in equine breeding.
It really does make you appreciate both the science and the art of reproductive management in horses. And maybe a final thought to leave you with. We've talked a lot about diagnosing and reacting to prolonged diastresis. Given how much it can impact breeding efficiency, what might the future hold? Could we perhaps see technologies or gain insights that allow us to predict or even prevent some of these disruptions before they happen, rather than just treating them after the fact? Something to think about until our next deep dive.